It was on the soccer field that Kyle Walsh and his mother Connie first realized something was wrong.
It feels like you're getting left behind and like you're worse than other kids.
His face is red and he's got his hands over his head, and I'm looking at other parents like, what's wrong with him?
It turns out Kyle has asthma, and like millions of others, he quickly learned that running during soccer isn't the only risk he runs with this condition. Experts say this is the most dangerous time of year for kids with asthma. Fall means more allergens, more time around other kids, and more threats from cold and flu season.
Actually, colds are the #1 thing that land kids in the hospital, is that they'll come down with a cold, they'll start having some cough on day 2, and by day 3, they're in trouble.
Dr. Beth Allen is an asthma specialist at Nationwide Children's Hospital. She says kids with asthma already have an immune system that's dealing with one disease, so an assault from a second can be dangerous.
30% of the kids who end up in the hospital with flu have asthma, so they're clearly at increased risk if they get flu to get quite ill, not only with their asthma but also pneumonia.
To help protect kids with asthma this time of year, doctors suggest these 3 steps. First, get them a flu shot. This will give your child a head start on battling the flu virus before they're exposed to it. Take your child in for a fall checkup to get a good reading on their condition, and work with your doctor to come up with a written action plan.
They need to be able to recognize the symptoms, know which medicine to use if they develop, and also know when to call the doctor if that medicine is failing.
With the cold or flu, asthma can get serious quickly, but preparing for problems before they occur can help kids stay healthy and parents breathe easier. At Nationwide Children's Hospital, this is Clark Powell reporting.